Hi everyone, I'm Kevin Kincaid and I'm your host for today's webinar, all about the upcoming changes to TRICARE. Today we are pleased to have a guest presenter, Mr. Christopher Lopez. Chris is the Chief of Strategic Outreach and Engagement for the Military Health System and has worked in military health as a civilian since 2007, overseeing various elements of congressional and public affairs. A graduate of the United States Merchant Marine Academy, commissioned in 2001, Chris also serves as a public affairs officer in the U.S. Navy Reserves and has had several assignments in his military career, both at home and abroad. Welcome, Chris, and thank you so much again for sharing this topic with our membership. We have a few slides for you guys today, and we'll be talking for about 30 minutes. If you have any questions, please feel free to type them in the questions block on your screen at any time, and we will be following up with those questions following the webinar. AAFMAA stands for American Armed Forces Mutual Aid Association and is the longest standing not-for-profit association that empowers military families with affordable financial solutions. We accomplish this by being the premier provider of affordable life insurance, expert investment management, customized residential mortgages, and our exclusive survivor assistance services, all for the military community, not for profit. The content of this presentation today is provided by the Defense Health Agency, as I mentioned before, our guest Chris. As such, AAFMAA is not responsible for the information presented. For individual concerns about TRICARE, please note the contact information shared during Chris's presentation. We produce this webinar series in-house with our own professional staff as a service to our members and to help them better understand the resources that are available to them. I will now go ahead and turn it over to Chris Lopez to start the presentation.
Great, thank you, Kevin, and what a pleasure it is to be here with you today. So on behalf of Vice Admiral Bono, who's our director at the Defense Health Agency, I just want to thank you for this invitation to participate in an AAFMAA webinar. And she's asked me today to just inform you and your members about several, what we would characterize as transformational changes coming to TRICARE. If you can turn to the first slide, please. So Admiral Bono starts almost every brief off with this slide, and the point that she's making is that whether it's a service member deploying in harm's way, the family they leave behind at the home station, or the retirees who have served our nation so well, we need to keep our beneficiaries at top of mind. So that's why we're so excited about the changes coming to the TRICARE health plan. These changes are mandated by Congress from the National Defense Authorization Act passed into law last year. There are also changes related to 2 new contracts that we've issued to manage care support contractors who build our networks for those who receive care outside of our direct care MTFs around the world. So DHA is essentially using a combination of the NDAA changes and the contract changes as an opportunity to build a stronger and more integrated patient-centered system for our beneficiaries. So before I get into the changes, though, I'd be remiss if I didn't do a quick commercial for the MHS. And really, I say that with a smirk, but for all our beneficiaries, this is your military health system. So just kind of a brief snapshot of what the MHS is and kind of where the DHA fits in. So so first, the military health system is an indispensable system of health with what we'd say unparalleled and breadth and capability. It's worldwide, and it ensures that our service members are ready to go anywhere at any time. In support of this mission, it also oversees the TRICARE program, which takes care and cares for 9.4 million beneficiaries, which includes service members and their families and the retirees. So there are 7 main components. There's the policy arm, which is the Assistant Secretary of Defense for Health Affairs. There's a Joint Staff Surgeon at the Joint Staff. There's Army Medicine, Navy Medicine, Air Force Medicine. We have a uniform universities of health sciences and the Defense Health Agency. And really our core responsibilities as a team include ensuring a medically ready and a ready medical force. So like I mentioned, we have 1.3 million active duty service members and roughly 800,000 members of the reserve component. So as well, we have a network of 55 hospitals and 373 clinics, which provide direct care to our beneficiaries. We also manage that global health for the TRICARE program, global TRICARE program, which is the purchase care side of that. We ensure public health. Some people don't know this, but we safeguard the air, water, and the food safety in all our military locations, and we monitor infectious disease worldwide to protect our service members and all Americans through the combatant commands. We also have a robust education and training component where we operate a medical university that develops the future medical leaders of our force. And finally, we are leading the military medical research and development. We have roughly $1 billion annually that we use that we direct with and work with some private organizations to make sure that we're focused on the latest and greatest available for our beneficiaries. So moving to the next slide, just so where the DHA fits in. So first and foremost, the Defense Health Agency is a combat support agency. So what is a combat support agency? That that can be inside term for a lot of folks that are outside of the Beltway. But simply put, we ensure the combatant commands have the medical capabilities they need to get at their missions and fight the wars. We make sure that the services, we enable the services to have that medically ready force and the ready medical force. And really, our value is the enterprise approach. So, I mean, we're working to reduce variation, increase standardization, and the like. For instance, I mean, just a simple thought is, making sure that our providers practice on the same equipment stateside that they're going to use when they deploy. So that's just a simple example. But you'll see our priorities and goals here, and I want to really focus on the second one. And my boss, Admiral Bono, this is one of our top priorities here. And so co-creating an optimal outcomes for health, well-being, and readiness. So the co-creating piece is we really want to know what the beneficiaries think, and we firmly believe this is their plan, and we want to make it suit their unique needs and honor their sacrifice. So moving to the next slide. So just kind of moving into the TRICARE. So we, there are a lot of changes coming up to TRICARE starting in January, but we still feel that we are honored to provide what we would consider a superior benefit to all those who have served and sacrificed. TRICARE is truly one of the most comprehensive benefits in the nation. So we're honored to be able to manage this for our beneficiaries and continue to look for feedback to how we can make sure that it meets their needs. So next slide, please. So this is just a slide showing kind of a snapshot of what a week in the life of TRICARE. So you can see there's nearly 20,000 inpatient admissions, nearly 2 million outpatient visits, births. That's one of our biggest business lines. So I won't read the entire slide. It's more for you and your members to kind of just see the scope and the breadth of what we do. The awe of the magnitude. Yes. So now kind of diving into the reforms. So just kind of a broad overview. So last year, like I mentioned, Congress made a lot of changes to TRICARE. I'm going to touch on some of the bigger pieces in a second, but want you to know kind of some of the overarching direction of our reforms. So the first is improved access. So this is giving patients more tools and abilities to easily access care and not use the emergency room when it's not needed. So modernizing the health plan, and this is modeled on approaches used by commercial health plans. So you'll see now we're having an annual open enrollment, but designed to exceed the standards of commercial plans. I mean, so we're always striving to be the best. And then a simplified process, really making it easier to get what you need when you need it. So next slide. So this first slide is just showing you a few things that we've done to improve the access in our direct care setting. So the nurse advice line, you can talk to a registered nurse now 24/7 who can help you determine the right level of care you need for yourself and your child. You can also schedule an appointment based on that. We know that people now are using their mobile devices. They're using the computer to make their appointments. So we're focused on making access easier to schedule. I mean, check your scripts and whatnot in your labs. So urgent care, there'll be more urgent care access coming in some of these changes. One-call resolution, this is one issue that we know beneficiaries have had many concerns, and this is, I call the MTF and they tell me to call back later to try to get an appointment, and ultimately this one-call resolution policy, which was implemented recently, will require our MTFs to make sure that the patient gets off that phone and knows when their appointment is. So another thing is expanded hours, where we know we're working to do the best we can. Depending on where you live, that 4 o'clock in the afternoon may not be the best time for you. We know that folks with kids and crazy schedules, maybe 6, 7 at night will be better. So we're working to make sure we expand those hours to meet the needs. Okay, so now here, just kind of diving in to the changes. You should have access to a fact sheet which lays out in detail all these changes, and we're going to walk through kind of the main muscle movements, the wave tops, as we would kind of say in the Navy. So the first thing here is shifting to a calendar year, so previously, or up through this year, the enrollment for TRICARE Prime was based on fiscal year. So that'll be changing, and it's important to note, just based on people how they plan their finances. And so the enrollment fees will be prorated for an extra 3 months. We're kind of in the midst of that, the October through December, and then the deductibles and the catastrophic caps will be extended as well. Also is a new enrollment requirement for the TRICARE preferred provider option, which will be TRICARE Select, and I'll get to that in a moment. Previously, you never had to enroll in what currently is TRICARE Standard. That'll be changing. There'll be open enrollment periods and qualifying events that will be really the main windows in which you'll be able to switch plans. The good news is that the vast majority of folks will be auto-enrolled. In fact, really the only folks that need to really make sure, unless you're switching plans, make sure that they make a choice, are the folks that are retiring after January 1st this year, because they'll have to actually say, I either want to go TRICARE Prime or TRICARE Standard. Everyone else will be auto-enrolled. If you're a new accession, if you're in a Prime service area, you'll go Prime. If you're not, then you will be enrolled into Standard in your family. So that's the good news, is you shouldn't have to worry, but you need to know that if you want to switch plans, it's a different ballgame now. So moving on to the next slide here. Another change is, so we are consolidating 3 regions into 2. So back in the day, I think when all this started, there were about, I think, 12 plus regions. We're down to 3 in the recent T3 contract, moving to 2. So why is this relevant? Well, it'll be simpler for families as they PCS, less chance of you having to change contractors, less contract overhead from a government standpoint, so we're more efficient in using those taxpayer dollars as efficiently as we can. But the main point is that folks just need to also monitor as this change happens January 1, 2018. It's just that your providers are still in the network. That's the most important thing. The vast majority will probably stay in the network. So what's happening is Humana is taking over in the east, and HealthNet is taken over in the west. And so there's going to be some churn, and so the providers have to just make that choice to say stay in those networks, depending on which contractors in the region. So, but just that's the main point for beneficiaries, is that they pay attention to whether their providers remain in the network. So on slide 14, so this is important. So we have, like I'd mentioned before, is we have 3 plans that are moving to 2, and so TRICARE Standard and TRICARE Extra are going away. They're a thing of the past. So TRICARE Select will be replacing them starting January 1st, 2018. How does that change your health care is probably the first question people ask. Well, not a whole lot initially. I kind of mentioned the enrollment requirements. Most folks will be auto-enrolled. There are some cost changes, which we'll get into a little bit. But I mean, really, on the positive side, the new network will be much more comprehensive. And you'll see in the bullet there on the 85% of all TRICARE Select enrollees will be required to have, the contractor is required to provide a network that meets 85% of all the TRICARE Select beneficiaries versus around 70% today. So the other thing is just to note is even whenever we talk about changes, people are interested in what's not changing. So TRICARE Prime remains the same for active duty families, so you won't have to take any action. And so, believe it or not, the government actually looked at all these changes and said, you know what? Initially, the contract change was scheduled to happen in October, and the change from 3 plans to 2 was scheduled to happen in January. We said, you know what? We really need to take a look at this from a beneficiary standpoint. And actually, through discussions with beneficiary organizations, we came to that conclusion. Let's do it all at once so there's not 2 changes within 3 months. So make it easier for the beneficiary. So let's see that last bullet. The next thing is, so the Federal Employee Dental and Vision Program. So this is this was included in the defense authorization. And so this will be a new benefit for certain beneficiaries, which we're excited about. A lot of folks, a lot of retirees didn't have access to vision or dental, depending on what your status was. So starting at the end of 2018, that November, December will be the first open enrollment period. They'll have access starting in 2019 to what all federal employees have as far as vision and dental. So we'll have, instead of hey, this is your dental plan, if you want to sign up for it, they can look at what FEHBP has and make the best decision for their family. All right, so kind of getting into cost here. So this is where it gets, I would say, complex, and people really need to pay attention to where they fall out in what cost group. So the defense authorization required 2 groups, and we're calling them Group A and B because that's just what we came up with, and no one had a better idea. But Group A and Group B. So really, Group A, and one of our TRICARE director came up with this, is folks that are already here. So folks whose sponsor enter the military before January 1st, 2018. Group B are folks that have not joined up yet, and folks that assess or join the military January 1st, 2018 or afterward. So the reason it's important to know which group you're in is because as you look at the cost tables, they are listed by group, and a combination of Congress and regulation stipulates certain costs for certain groups. So,
quick question
yep.
on that. So do cadets and midshipmen, are they considered in Group A if they're currently in academy?
So it'll actually be their date of commission.
Okay.
So
great.
that's
so if they're currently there and they don't commission until May,
correct.
Then they're in Group B.
Correct.
Got it.
Yep. So another thing to note, which I don't have a bullet on the slide, but those who are in our premium programs, and those include TRICARE Reserve Select, TRICARE Retired Reserve, TRICARE Young Adult. Regardless of when your sponsor entered, you will be paying Group B cost shares. So it's important to note that. I don't have it on the slide, but it should be in the fact sheets that are available. So TRICARE fee changes going off the Group A and Group B. So for active duty families, if you're prime, your cost sharing is going to remain the same. If you're select, we've actually, so currently you have a cost share that's percentage based when you go see your provider. We've changed that to a fixed and predictable copayment. We think that's going to be easier for folks as they budget, and so they know what their costs are going to be. And a lot of those copays now include some of the ancillary services, like if you need a lab that's associated with that visit. All that's included. It's also better for providers too, because they also the predictability is helpful for them.
Right.
For retirees and families, so prime and select cost sharing increases based in accordance with law and regulation. So that's where, if you take a look at those cost tables, you can see how some of that's changing. And if you or your members have questions, we're happy to answer those. But
yeah,
so
and just real quick, yep. Sorry, Chris, I'm not sure I mentioned before, but you guys can find the fact sheets that Chris mentioned in the handout section of your webinar panel, and you can download them from there.
Right. And whenever we talk changes, I think I already mentioned this, people become interested, even if it's just to know that things aren't changing for them. So For the big one is TRICARE for Life. For those of our folks that have that Medicare wraparound coverage, nothing's changing for you. So you get sigh of relief. That is staying the same. TRICARE overseas staying the same. We always need to make a point of that because there's a large part of our beneficiary population that is TRICARE for Life. So
yeah, a big part of our membership is retirees, and I'm sure there's a lot on the phone right now who are very happy to hear that.
Yeah, and maybe I should have led off with that, and so hopefully they are listening long enough and sticking with us to get that important piece of information. So what are we asking you to do? One, take a look at the fact sheets that are out there, but just kind of the wave tops here. If you like your current plan, you really don't need to do too much. You're going to remain in it. You're going to be auto-enrolled, and if you're in standard, you're going to be auto-enrolled in select. The only thing you have to really just be aware of is that now when you want to change your plan, it's going to be during an annual open season, which I don't know if I mentioned it before, but it'll be November, December each year, or a qualifying life event. And really qualifying, I mean, for those who are familiar with civilian plans, they'll include the birth of a child, marriage, PCS, other things like that. Again, some of that is spelled out in the fact sheet. So it's important to note that. And for service members that are transitioning to retirement, I mean, this is a big change. You're going to have to make a decision. No longer do you just go through your TAPS program and TRICARE standard is there. You will have to make a decision, and that information we'll get through the TAPS programs and the preparing for retirement programs that the military offers. But this is one of those issues we want to over-communicate. We don't want anyone we don't even want one family or service member to not know and be without health care coverage, because we know that has huge cost implications and the like. So that goes to the next bullet, is just educate yourself on the cost changes. We believe some of the changes are modest, but some of them, like I said, with converting from a percentage-based cost share to a fixed copayment, we think will be better for our beneficiary population and our providers. And of course, this is always a foot stomp that we do here, is just make sure that you update your family, your information in DEERS. So if you get married, you have a dependent, you have a child, that stuff doesn't automatically populate. You have to go do that, and do it as soon as you can to make sure that your family has the coverage they need. So moving on to the next slide is, because this is our kind of call to action, everyone on this webinar, is we're asking you to sign up for updates. So not only do we have the information on our websites, but it's constantly changing. There's legislation that Congress passes every year, and even recently, kind of pending legislation will likely bring about some other changes. So the best way to keep up to date is sign up for changes at www.tricare.mil/changes, and of course spread the word. If you know other beneficiaries who use TRICARE, let them know. Because we don't, like I said, we don't want one. Our goal is to not have one family or service member or retiree that does not have received this information. Whether we'll get there, we don't know. But that's why we're working with organizations like yourself to really spread a wide net. And so, another foot stomp is we always like to connect. We like to connect with folks. So you can see our director there, Admiral Bono, to the right, and our senior enlisted leader, Command Sergeant Major Luciano, meeting with military and veterans service organizations who we meet with monthly, and they've been with us. Ever since these changes were being discussed, and they've been a big part of making sure we're doing our best to make this something that really serves beneficiaries in the right way. So you'll see our Facebook information and our Twitter information. So please consider connecting with us. And so that's our last slide. And so Kevin, I'll kick it back over to you.
Terrific. Yeah, and thanks so much again, Chris. This was great information. I hope everybody out there listening was able to get the information that they needed. If you did submit a question during the presentation, we have recorded those. We're not going to answer them today, but we will follow up with you directly to make sure that you get the answers that you need. Also, if you think of another question later, Chris has offered to field those questions, so please feel free to reach out to him. His email address is christopher.a.lopez3 stateside.civ@mail.mil. We'll go ahead and break here for now, but you can connect with us whenever you need to at membership@afma.com. Please don't hesitate to reach out to us for assistance. We do this every day for our military community, and it is our pleasure to do so. This weekend, you'll receive a follow-up email with instructions on how to access a recording of this presentation. And you can always register for future webinars and review past webinars at afma.com/webinars. Speaking of future webinars, be sure to join our colleagues at AAFMAA Wealth Management and Trust later on this month for their next webinar. If you found this information useful, we encourage you to please share it with your friends and family. As Chris mentioned, getting this information out is critical to make sure that everybody maintains that coverage and they don't lose it. Our membership grows stronger every year because you introduce those in your military community to AAFMAA. Thank you again, Chris, and to the Defense Health Agency for sharing your expert knowledge on this important topic with our membership. And thank you all again for listening and for joining us today. We look forward to the next opportunity to assist you.